Good afternoon, everyone, and thank you for joining us for today's conversation on opportunities to optimize family health through Wic Modernization. I'm Dr. Danielle Cullen, faculty researcher at PolicyLab and an assistant professor of pediatrics and pediatric emergency medicine at Children's Hospital of Philadelphia and the University of Pennsylvania's Perelman School of Medicine. We are thrilled to be partnering with Thriving PA for today's virtual conversation. Thriving PA is a nonpartisan statewide campaign that seeks to improve the quality of and increase equitable access to a coordinated system of health supports for birthing parents and children, including nutrition. Specifically, Thriving PA has prioritized supporting the financial stability and modernization of WIC to ensure food security and nutrition for pregnant women and young children. With that goal in mind, together, we invited today's panelists to share their perspectives on modernizing WIC, including opportunities for Pennsylvania. Thank you to our colleagues at Thriving PA for your partnership. The Special Supplemental Nutrition Program for Women, Infants, and Children, otherwise known as WIC, provides nutritional support and education to pregnant and breastfeeding women and children 5 and younger who have a household income of up to 185% of the federal poverty level. WIC has important health benefits for families participating in the program, including lower rates of preterm birth, decreased food insecurity, and improved nutrition, as well as improved access to healthcare and social services. However, utilization of the program is low among eligible families, and enrollment continues to decline year to year in several states, including here in Pennsylvania. Even prior to the pandemic, only about half of all eligible families received WIC benefits, in part because of the significant administrative burdens families face when enrolling in WIC and when accessing and redeeming benefits. As a clinician and researcher, I strongly believe that programs like WIC are essential for the health of children, and it is our collective responsibility to ensure that these programs are strengthened, grown, and layered in order to best serve children and their families. Food insecurity is all too common, often hidden, and inextricably linked to health. I see the connections between food insecurity and health every day in the pediatric emergency department. The kids who come in with terrible headaches and stomach aches, quickly cured by a turkey sandwich. The new cases of obesity-related diabetes because families can only afford inexpensive, calorie-dense, and nutrient-poor foods. One particular example haunts me every day, a 3-month-old baby who came in seizing because of severely low sodium levels. We later found out that the family was forced to make the dangerous decision to water down the baby's formula in order to make it last to the end of the month. The COVID-19 pandemic deepened challenges for the nearly 1 in 4 children who are already food insecure in Pennsylvania and created new barriers for families who never previously struggled. The sustained period of food insecurity has been driven by the convergence of multiple structural and individual level factors, including pandemic-related unemployment that disproportionately affected low-income families, school closures that limited regular access to federal lunch programs for over 1 million children in Pennsylvania, and unprecedented demand for the charitable food system resources, compounded by social distancing measures that limited their capacity to meet community need. In the face of these challenges, one could argue that federal food assistance programs like WIC and SNAP have become more essential than ever before, but significant barriers to participation remain. Since the pandemic, many states have been able to increase participation in WIC, particularly with the transition to remote certification and remote or online benefits reloading. However, in Pennsylvania, participation has continued to decline, in part because of the limitations of offline, in-person, or mail-based reloading of electronic benefits. Since WIC funding is discretionary, decreased enrollment may lead to reduction in funding, which means that WIC agencies have fewer resources to support operations, outreach, enrollment, and retention efforts. This can lead to a further decline in enrollment and subsequently less funding, triggering a vicious cycle that's difficult to reverse. For the purposes of today's conversation, we'll focus more closely on opportunities for modernizing WIC systems to ensure that the program is meeting the needs of families and optimizing programmatic reach. We're excited to be joined by a terrific panel of speakers for this discussion. A couple of reminders for those listening in today. All attendees' lines will be muted and video will be disabled throughout the event. We're looking forward to a robust discussion following our presentations. So if you'd like to submit a question, you can do so anytime during the event using the Q&A feature located on the right-hand side of the platform. My colleague Radha Panadi, who is a Policy and Strategy Senior Associate at PolicyLab, will join me in moderating the Q&A portion of the event. They'll also be monitoring the questions and will turn to them after the presentations. Before we dive in, I'd like to introduce our panel of speakers. First up, we have Laura Stephany, Health Policy Manager at Allies for Children, where she leads efforts to advance the organization's health policy agenda, affecting change on a wide range of children's health issues, including insurance, school meals, early childhood nutrition, and safe and healthy housing. She is also the co-chair of Thriving PA's Nutrition Subcommittee. Next, we have Dr. Aditi Vasan, a faculty member at PolicyLab and pediatrician and health services researcher at Children's Hospital of Philadelphia. Aditi's research is focused on improving health outcomes for children and families living in poverty by improving their access to government benefit programs and community resources. More specifically, she studies the impact of WIC policies, including electronic benefits transfer and in-person versus remote benefit reloading on state-level participation. And she's interested in modernizing WIC enrollment and redemption to increase access to benefits. Next, we have Barry Kelly, Director of the Bureau of Community Nutrition Services and State WIC Director at South Carolina's Department of Health and Environmental Control. Barry's work focuses on supporting healthy people living in healthy communities across South Carolina. And lastly, we have Brian Dittmeier, Senior Director of Public Policy at the National WIC Association, where he's responsible for managing the association's advocacy strategy to advance the National WIC Association's public policy priorities, including efforts to secure WIC funding and ensure efficient program administration. Brian also oversees the National WIC Association's relationship with Congress and the administration, leads targeted grassroots advocacy efforts, and coordinates policy partnerships with child nutrition stakeholders and industry. To get us started, I'm going to hand it over to Laura to share more about the importance of WIC. Laura, we know that WIC can be a valuable resource for families and has many important benefits, but in Pennsylvania, enrollment and utilization continues to decline. Can you talk about why this is an important issue for Thriving PA?
Thank you, Dr. Cullen. In Thriving PA, as Dr. Cullen mentioned, we focus holistically on a comprehensive portfolio of services to improve maternal and child health. These include health insurance, doula care, lead poisoning prevention, childcare, and nutrition. Looking at this context, the benefits of WIC for children and families are really clear. WIC plays a crucial role in improving lifetime health for women, infants, and young children. WIC addresses several health concerns, including obesity, diabetes, and maternal and infant mortality. More than 4 decades of research have documented WIC's positive impact on child health measures, including birth weight, diet quality, initiation and duration of breastfeeding, and immunization rates. The more we learn about brain development in early childhood, the clearer the case for investing in this program becomes. During the first 3 years of life, infants and toddlers' brains make huge gains in development. It's critical for families and children to have access to health supports and proper nutrition during this time. WIC ultimately leads to higher academic achievement for students. It's cost effective. Every dollar that's spent on prenatal WIC yields $2.48 in savings for medical, educational, and productivity costs over an infant's lifetime by preventing preterm birth. But as Dr. Cullen mentioned, it's really underutilized within PA. And the declining participation has had a substantial impact on Pennsylvania's program, really hampering its ability to ensure that children and families in PA can thrive. In recent years, the participation has dropped significantly. Between 2016 and 2020, Pennsylvania's participation declined by over 50,000 enrollees, and over 21% of the participation saw a decrease. We saw on the slide that Dr. Cullen just shared that the pandemic has only exacerbated this trend. As Dr. Cullen noted, funding is tied to participation. Declining enrollment means declining federal funding. In 2018, we experienced a $3 million reduction in funding, followed by a $1.5 million reduction in 2019. Between 2009 and 2019, funding for the state of Pennsylvania decreased nearly 18%. These reductions really hamstring local agencies' ability to engage eligible participants and to serve those in need. And it creates further declines in enrollment. Like Dr. Cullen said, it's really a vicious cycle. But within these challenges, there are opportunities, and that's why I'm excited about where Thriving PA comes in. There's a huge need for advocacy and collaboration across the state, across sectors to reverse this trend. That's why we're advocating to modernize WIC. This is ultimately going to boost participation and financially stabilize the program here in PA. Thriving PA issued a policy brief highlighting the top recommendations and opportunities for improving WIC participation in Pennsylvania. Our number one recommendation in the brief is to modernize the EBT card and transition to a fully online system. Many states saw improvements to participation during the pandemic, like Dr. Cullen mentioned, but PA and 8 other states that have offline systems missed out on these opportunities to enhance their WIC growth and these gains. You saw that curve on the slide that Dr. Cullen shared. Modernization is really key to turning the corner on our participation declines here in PA. And not only that, we really want to make sure that Pennsylvania WIC is poised to take advantage of a lot of great opportunities that we see on the horizon for WIC moving forward. I'm really excited to hear about those opportunities from Aditi, from Barry, and from Brian. Right now really is a crucial time. The Pennsylvania Department of Health and the Bureau of WIC have made great strides with communication, transparency, and inviting collaboration with partners. Pennsylvania WIC recently began publishing participation data, broken down by county, by race, and by participant type on its website monthly. This has helped inform Thriving PA's recommendations, our advocacy, and our community engagement efforts. Next month, we're going to be beginning a series of focus groups across Pennsylvania to gain authentic feedback from parents who are participating in WIC. The goal of this is to really empower families to have a voice in the solutions to ensure that all children can thrive in this program. We're also thrilled at another opportunity. We're going to be seeing something coming to fruition that 2 years ago seemed like a pipe dream. Thanks to the partnership of the Department of Health, Pennsylvania is in the process of gathering applications for a state WIC advisory committee. We're really excited about this opportunity to harness collective expertise and passion that we have statewide for improving WIC. We also have legislation moving through the Pennsylvania Senate to codify this committee. The advisory committee is being molded to reflect feedback from not only families and advocates and stakeholders, but it's really important. It's going to actually reflect all of the stakeholders who are seeking to improve WIC. Parents are going to be a part of the committee, food security experts, medical providers, child and maternal health advocates, grocers. It's really going to be a great effort, and I'm so excited to see this finally coming to fruition. Family voice is really essential to crafting good public policy, and we're thrilled to see that participation. All of this momentum really just shows that now is the time to invest in the program. WIC in Pennsylvania faces a lot of deep and complex challenges that are going to require partnership, coordination at federal, state, and local levels among policymakers, administration officials, advocates, and most importantly, the WIC families.
Thank you so much, Laura. We're so excited to learn from what you learn with families as well and hear more about this committee as it takes shape. Next, we'll hear from Aditi. Aditi, as a pediatrician and researcher, you've identified some of the barriers that families face in accessing WIC benefits. Tell us more about what challenges exist for families in accessing WIC and what research questions that led you to explore.
Thanks for that question, Danielle. As a pediatrician, I became interested in studying the WIC program, both because I understand how food insecurity can impact children's health, as you heard earlier, and because I kept hearing from parents and caregivers about the barriers they were facing when accessing WIC benefits. In particular, when I asked what made it harder for them to get connected with WIC, a lot of families talked about having to travel to the WIC office in person to certify, having to shop at WIC-approved vendors, and then having to find WIC-approved products in store where they're not always clearly labeled. And then during the COVID-19 pandemic, we heard from a lot of families who were nervous about having to go to their local WIC office in person, often traveling by public transportation and risking exposure to the virus just to reload their WIC benefits. And then I learned, as you've heard, that this problem was actually unique to Pennsylvania and just 8 other states. So as many of you know, in most states, WIC benefits are reloaded and loaded onto an electronic benefits transfer or EBT card, which functions like a debit card to buy WIC-approved products. During the pandemic, USDA waivers allowed for both remote certification, meaning families can get approved for WIC without having to go into the office, and remote reloading, meaning families could have their EBT card reloaded remotely without having to go in to their local WIC office. And most states were able to implement both remote certification and remote reloading, making it much easier for families with barriers to transportation to access WIC. However, Pennsylvania and 8 other states have offline or in-person benefits reloading systems, meaning EBT cards are reloaded on machines located physically at local WIC offices. And so families had to travel to their WIC office to get benefits, even during the pandemic. We wanted to study how this difference in reloading affected participation. And so we conducted a study comparing participation trends before and after the pandemic in states with and without remote reloading. And we found that while participation trends were similar before the pandemic, when the pandemic began and remote certification and remote reloading waivers were put into place, there was a huge surge in participation in states that allowed families to certify and reload benefits remotely, while participation in states like Pennsylvania with in-person reloading continued to decline. As of January 2021, WIC participation was 14% lower in offline states, and this corresponds to 160,000 fewer beneficiaries across these 9 states. And again, while our data was only through January 2021, we do have evidence that participation has continued to decline. And so the differences now are even larger and are likely to continue to grow because of this sort of vicious cycle where decreased participation begets decreased funding and decreased outreach. And so our research really provided evidence that in-person reloading was associated with decreased participation, and that remote certification and reloading may have increased participation in those 41 other states. We think this speaks to several opportunities for WIC modernization that are very much aligned with what you've heard from Laura and the thriving PA team. First, for offline states like Pennsylvania, it points to the importance of adopting online benefits reloading really as quickly as possible. And in the meantime, working to find other ways to make it easier for families to travel to their local WIC office and reload their card, for example, reducing the frequency with which they have to reload. And second, for all states, our study suggests that continuing to allow remote certification through phone or video visits, even after the pandemic, may help boost participation. There's some evidence to suggest that families like having the option to do their WIC visits either remotely or in person, and that particularly for families with young children and barriers to transportation, it's much easier to do these visits at home. In addition, streamlining data sharing between pediatricians' offices and local WIC offices could help facilitate remote certification and renewal of WIC benefits by eliminating the need for families to travel to a WIC office in person just for height and weight measurements, hemoglobin, or lead screening when their primary care provider has already conducted these screens. In addition, adjunctive eligibility, so that is simplifying the enrollment process for families who are already enrolled in similar programs like Medicaid, SNAP, or other programs and have age-eligible children, could help boost participation, really by making it easier for WIC agencies to proactively identify and enroll eligible families. We really hope to see all of these changes made in the upcoming years, particularly in states like Pennsylvania that have seen such a precipitous drop in participation, in order to help families get the benefits they need to feed their children and really to keep them healthy.
Thank you so much, Aditi, for sharing that staggering data and those really actionable solutions and opportunities. Next, we're going to turn over to Barry to hear about South Carolina's WIC program and the innovations that they've pursued. Barry, we've discussed how WIC is an important resource for families, but families face administrative burdens to accessing these benefits. What is South Carolina doing to make WIC more accessible to families?
Well, first of all, I'm super excited to be here and share some of the wonderful things that's going on in South Carolina. We have really focused on maximizing technology to improve service delivery. When I first arrived as the state director here in South Carolina, I traveled the state. We have 76 sites. I talked to our staff, I talked to our participants, and what they shared with me was that we need to modernize the program. We need to focus on technology. Our moms are busy. They're working 2 jobs, they're in college, so time is very, very important to them. And so we want to meet them where they are by maximizing technology. We actually transitioned to electronic benefits in November 2019, and it has been a huge success. Our participants absolutely love it. The card looks very much like a debit card. It removes that stigma at the point of sale, and it has really improved the shopping experience for our participants. Currently, we have over 55 classes that our participants can go on their smart device and complete online. 76% of those lessons were completed on their smartphone. They prefer to do the lessons on their smartphone versus coming into the clinic in person. Over 42,000 lessons were completed on their smart device last year. We also have developed a very cool mobile app that our participants absolutely love. Currently, we have 70,000 users that actually utilize our mobile app. They can scan their food items to make sure that it is WIC approved and really remove that concern that they have before they get to the point of sale. They can hold their head high and know that that WIC approved, that food is WIC approved already, and it has improved the shopping experience as well. We can also send them healthy recipes through their app. They can also identify where the clinic locations are. It's just a wonderful, wonderful tool that our participants absolutely love. Because we've been focusing on maximizing technology when COVID hit, we were able to transition to providing WIC services 100% remotely. We are an online state. So being online gives you a lot of added benefits. During a natural disaster, you can upload the benefits for the participants, send those out. And also during COVID-19, it has allowed us to reduce the risk to WIC staff and participants because we're providing services remotely. We also purchased 4 services on wheels. Those are mobile clinics that can go into the community where our participants live, work, and play, and provide on-site certification. We are really focusing on collaborating with organizations that provide services to the same population that we serve. We work with Head Start, First Steps, and other programs here in South Carolina to serve the great people in our state. We're also really looking to improve the shopping experience. That is a huge part of the program. I heard one of my colleagues talk about the amount of funds that are being sent back. We want to keep those funds in the state. So now our participants can go to the stores, over 633 stores across the state, and they could go up to a self-checkout area and self-checkout and do other things there. The National WIC Association has done an amazing job putting forth a legislative agenda for the Biden transition team when the Biden transition team came in, really focusing on maximizing technology. Some other things that we're looking at is also access, offering clients alternate hours to visit the clinics across the state. We're maximizing data. We have a needs met report. I know how many clients that we're currently serving in South Carolina. Right now, we're at a little over 45%, so that's less than half of those that qualify for the program. But when we used all this technology, we saw a 6% increase in our needs met in a short period of time. So we're really focusing on maximizing data as well. So those are some of the exciting things that are currently happening in South Carolina. Thank you.
Thank you so much, Barry. It was wonderful to hear about that use of technology and really working on meeting families where they are. We're next going to welcome Brian. Brian, WIC is a federal program, and while there's considerable opportunity for states to guide the implementation of WIC, federal policy and resources are an important factor. How is federal policy informing and supporting the modernization of WIC?
I think that's a great question, and it's great to be here and to hear all of the perspectives already presented on this panel. I think this is a really exciting time for WIC. WIC has, for nearly 50 years, demonstrated its effectiveness at improving health outcomes, but we have an opportunity to not just learn the lessons from how we operated during COVID-19, but to also address some of the structural factors that have inhibited the program from reaching the entire eligible population. And so this is a moment to get the change done and to build a stronger, more accessible, and more resilient program for the next generation of new and expectant parents. And a lot of the ideas that have already been shared are the key to that success. And I think COVID-19 and the program's response to operating in that social distancing atmosphere really lit the fire under some of these long brewing conversations about not just how do we make it more make services more participant friendly, more accessible, but also how do we coordinate and think about the best use of time and resources with healthcare as well. And these are big questions that are going to, continue to be thought about and deliberated on and innovated on in this space for the next decade. And so we have a lot of opportunity to move that forward. I want to focus on a few different moving vehicles here in delightful, sunny Washington, D.C. today that could really have an impact at the state and local level as well. So the first is that Congress is considering this year and should consider and get it done, the child nutrition reauthorization process. Many of us are familiar with this, but it is the legislative vehicle where you can get policy reforms not just for WIC, but also for CACFP, school meals, and summer feeding. And it is through that child nutrition reauthorization that we can enact different expansions of eligibility, such as expanding postpartum eligibility to 2 years to address the interconception period, but to also address some of these structural challenges around certification. Dr. Vassen mentioned adjunctive eligibility. We've been talking about remote certifications. Those pieces need to be codified in the long term so that when the pandemic flexibilities expire at the end of the public health emergency declaration, that we have the ability to have this new balance. There is bipartisan legislation that's been introduced called the Modern Wic Act that is now introduced in both the House and Senate that would allow for more flexibility to get those nutrition assessments done and that they could be done, the health screenings could be done by a pediatrician or a physician and then shared with WIC. And those are key flexibilities that have worked quite well during the pandemic. And on the national scale, we've seen about a 10% increase in child participation as a result because we're able to keep the kids on the program with more flexible certification opportunities as the children grow and continue on the program. So getting that child nutrition reauthorization done is critical. The second piece, and we haven't touched too much on it, but I think it's a really important piece, is increasing the value of the WIC benefit. We know that before the pandemic, the WIC benefit accounted for only 9% of a household grocery budget, whereas the average SNAP benefit accounts for 52% of a household grocery budget. And that's a huge disparity. Now, WIC and SNAP are different programs and operate in different ways, but it is important to note that the value of the WIC benefit is an important carrot. It's an important draw that brings people into the WIC program and connects them with not just the food benefit, but also the nutrition and breastfeeding services that are complemented and really help drive the difference in family behaviors in the long term. And so increasing that value of the WIC benefit, increasing access to nutritious and healthy foods is critical, and WIC can play a leading role here. For just about a year, we've had increased fruit and vegetable benefits. So sustaining that in the long term is key. But USDA, the U.S. Department of Agriculture, has the opportunity with a rulemaking, regulatory activity, to enshrine a permanent higher value for fruits and vegetables and for other food groups in alignment with nutrition science. And so we have a strong foundation for that, but it's up to USDA to get that done this year. And the WIC community needs to be leading the way in making sure that that gets accomplished. And then the other bucket that I want to flag is the idea of innovation and technology that we've been discussing already. And there's a pot of money called the 390 Fund that's at the U.S. Department of Agriculture that's supporting outreach, innovation, and program modernization activities. And those activities can also happen at the state level with state WIC grants and projects that are happening, as Barry mentioned, in South Carolina. There's no need to wait to innovate for the WIC program. And I think that we are seeing the potential that technology can play in reaching families and keeping them on the program. I think that the evidence is quite clear that in the short term that offline EBT systems are a barrier to access. And that is one of the strongest lessons learned during the COVID-19 pandemic. But it's not just about moving to online systems, and this is a conversation happening in every one of those 9 states that has offline EBT, 9 geographic states, I should mention, that have offline EBT. I think we need to also be thinking about the next generation of transaction technology. How do we get to e-wallets and mobile payments? How do we build online shopping into the fabric of the program? And how do we get some of the very popular vendors that are not allowed on WIC right now to be welcomed onto WIC, so that WIC shoppers have all of the access that SNAP shoppers and the general shopping public have. And so we need to be moving forward that innovation in the clinic space, in the shopping space. We can't lose sight of the potential to leverage WIC as a vehicle for farmers markets as well, and to bring farmers markets along with both the WIC and WIC Farmers Market Nutrition Program. But all of that innovation needs to happen thoughtfully but rapidly, because WIC participants and WIC families are waiting for those changes, and it will make a difference. Before I pass things back to you, Dr. Cullen, I do just want to flag that we've been talking about some of the participation trends in Pennsylvania and throughout the COVID-19 pandemic. But going back to 2000, which is the first time that USDA analyzed the eligible population for WIC, we have never served more than 65% of the eligible population nationwide. So there are specific barriers to access in the technologies that exist today, but there are some structural problems that need to be addressed. And that coordination with healthcare, the flexibilities around certification, those pieces need to be fixed if we're ever going to reach the full child population and make sure that we're having the impact that we need to have to build a healthier next generation.
Thank you so much for these comments. To all of our panelists, a huge thank you. You have such a wealth of information, and I'm excited to see many questions that are popping in from our audience participants. As a reminder to everybody, please feel free to put your questions in that Q&A section on the right-hand side of the screen. We're going to start with a question for all of our panelists from PA State Senator Judy Schwenk. Which states, does the federal funding also extend to funding state staff who implement the program? Does the funding extend to costs for implementing new technology? Thanks for the information on the federal grant in USDA.
Right, so the Federal WIC Grant really operates in 2 ways. There's the Food Grant and the Nutrition Services and Administration Grant, and those are annual grants that are funded through the annual appropriations process. The food funding is pretty limited in its purposes, and it's pretty self-explanatory. It's for foods and breast pumps as well. But then the NSA has to cover all of the other costs. So you're talking about nutrition services, breastfeeding support, client services, outreach, technology, staff salaries, rent for clinic spaces, all of these different pieces that come together to make sure that the WIC program not only can operate, but can deliver those high quality services. And what we know at the local level, and Pennsylvania local agency staff have been leading this conversation on the national level as well, is that there are growing challenges with recruiting and retaining credentialed staff, particularly registered dietitians and IBCLCs for lactation support. And WIC is not able to offer the competitive level of salaries that are needed at the local level to sustain these credentialed staff positions. And so we need to build up that NSA investment so that we can have higher staff salaries, so that we're thinking more thoughtfully about how we can keep credentialed staff in these positions, and how we can remake our way of doing business, our way of operating, to recognize the constraints of the budget while still delivering high quality services. And so that is through the annual grant. There are some funding opportunities outside of the annual grant to strengthen technology and innovation and program modernization, but a lot of that also falls on the state budget or the state grants to states. I don't want to say the state budget, the grants to states every year. And that is an ongoing pressure on state agencies as we're asked to do more and to bring more technologies in with limited and, as Laura was mentioning, shrinking budgets as well.
Yeah, I would like to share something on that as well, Brian. That was a great overview on NSA and food funds. In regards to funds to support WIC activities, they must be necessary and reasonable. And, so that is key to remember as well. I'm glad Brian brought up the point about staffing. Staffing is a key part of infrastructure. That's something that I've really been focusing on a lot here to make sure that we're paying our staff a competitive salary because the turnover rate is considerable here. And in order to administer the program to provide with services, we got to have those dedicated staff to do that. So that is something that we're really focusing on, and funding is a key part of that. So thank you for bringing that up, Brian.
Thank you, Barry. Thank you, Brian. I'm going to jump in with another question. Here and focusing, kind of shifting the focus here to WIC vendors. We've talked a lot about beneficiaries here, and vendors are also the folks that can accept the WIC benefits. And would like to hear a little bit more, Barry. I know you've been working on some innovative opportunities to work with vendors, and Aditi, this is an area of research interest for you, and I'm sure Brian and Laura, you have comments as well. Can I just turn it over to you, Barry, to tell us a little bit more about what's on the horizon, and then Aditi?
Yeah, thank you so much for that. Our vendors are absolutely crucial to our success here. We have 633 WIC-approved vendors here in South Carolina. We have a vendor advisory group meeting where we bring our vendors and corporate offices and we make them part of the discussion. They help us to develop our food package. When we transition to electronic benefits transfer, they had already transferred to EBT in other states, so they had great lessons learned for us here in South Carolina to really help us actually, transition to EBT ahead of schedule and below budget. So our vendors are absolutely crucial to our overall success, part of the conversation on everything we do. We oftentimes focus on the certification process, but the shopping experience is so important. So we're spending additional time with our participants in the clinic to talk to them about, the shopping experience, what we could do, and also working with our vendors to make sure that they understand that we need trained people at that point of sale. So when the participant gets up there, there's not an issue at the point of sale that could really impact that shopping experience. So vendors are absolutely crucial to our success.
Yeah, I would echo everything that Barry just said. I think the WIC user experience encompasses not only certification, but also a lot of stigma and inconvenience at the point of purchase. So I think improving the experience for families at WIC vendors is really crucial. And we're also really interested in vendor participation and how we can support WIC vendors in Pennsylvania and across the country. In one of our ongoing studies, we found some evidence to suggest that states that transitioned to WIC EBT from the previous paper voucher system did have a drop in vendor participation immediately afterwards. And so we're interested in thinking about how to mitigate that and really keep vendors in the program. And in addition, thinking about other innovative ways to get families benefits. So Brian mentioned online purchasing, and I think we were excited to hear about online purchasing pilots for WIC that are going to be rolled out in the next few months and years, because that's a really promising approach to help families and sort of meet them where they are in finding WIC eligible products and potentially even getting them delivered to their homes instead of having to go in and find stores in their community, and particularly in areas where WIC vendors might be harder to access.
Yeah, and we are really excited about those online ordering pilots that USDA has funded through the Gretchen Swanson Center for Nutrition. 4 different projects working with Walmart, with Hy-Vee, with Save Mart, and with Bush Foods. And so over the next couple months, we should hopefully be making some progress in that space. But I really want to underscore one of the points is that, yes, the work needs to be done to build out the technology in shopping to allow for online options and to modernize the transaction technology as well. But we can't lose the human aspect of shopping innovation as well. And as Barry mentioned, and several states have done this, is the idea of having a local vendor liaison who is a WIC staff that is in touch with the local vendors, can provide additional support for cashier training, and can be there in the store to support participants in finding eligible foods, approved foods, and navigating the transaction for the first time. That's one of the biggest barriers in assuring a redemption and ongoing participation, is the WIC shopping experience, the complexity of navigating that and making sure that participants, and especially what we consistently hear are participants where English is not the first language, where there may not be resources available in the language that the family can use to navigate the shopping experience. And so supporting those communities, supporting the whole WIC participant group to make sure that we understand how to navigate that shopping experience and can build the skills to do it over time.
I will just add that this is the reason that we have the Pennsylvania Food Merchants Association as a critical partner of our work in Thriving PA, and why we have worked collectively with the whole landscape of stakeholders in Pennsylvania to ensure that grocers are going to be an important part of the State WIC Advisory Committee that is going to be launched in the near future. So with all of those voices at the table, I think that we can collectively work towards these goals that the other panelists mentioned.
Thank you all so much. As a follow-up to this conversation about vendor and vendor participation, shifting a little bit to capabilities, there's a question that came through in the Q&A, is the technology developed in other states able to be adapted for use in Pennsylvania? And what might some of the barriers to implementation of this might be?
Yeah, that is certainly the hope of the online ordering pilots, is to it won't always be like plug and play, but the idea is to have as interoperable of systems as possible, and recognizing that a lot of WIC vendors tend to operate in multiple states, and making sure that we can build that technology across state agencies. Keep in mind that there are only a handful of companies that actually conduct the EBT transaction, and so our goal is to make sure that we're working with all of them across the state agencies, and then we can plug that out to both the state WIC agencies and the retailers as well. One of the other spaces too, and keep in mind that USDA is going to be doing another rulemaking on the vendor regulations around online shopping. So there's an opportunity for regulatory reform in this area as well, which could open the door to virtual vendors that have not historically operated in the WIC space. And so I'm sure there are a few companies that are keeping an eye on this space and would be able to connect with that EBT technology once it's developed to conduct WIC transactions online.
Thank you for that. And as another follow-up, something that I've been wondering about as we've been talking about all of this with scaling of technology, Barry, this is a question that's largely for you, just in terms of the app that's being used in South Carolina. How is this funded? How is it implemented? How can we do that? And I see that there's somebody's question in the Q&A about what is this app and can we look it up?
Yeah, you can. I'm glad to share contact information you all have. We work with our vendor, GCOM, who used to be Three Sigma, to help us to develop this app here. Many states across the nation currently have an app, and we're glad to share any information that we have in regards to that.
Yeah, and I think it's key to share that the apps can have many functions. So one of the key pieces is the balance inquiry. So what is left on the EBT card for the participant to redeem for the remainder of the month? So that's a key piece. The ability to scan the barcode of WIC-approved products in the store as a way to resolve any challenges before the transaction is also helpful. But states have been able to build in nutrition education modules, recipes, clinic reminders, or appointment reminders, clinic locations, a whole bunch of other features. that are participant facing. And so it really is a highly popular and highly utilized tool that participants can use to interact with not just the shopping element of the program, but the whole breadth of services.
Yeah, hey Brian, thank you for getting more in detail. I actually just pulled up our app here on my phone, and we got appointments, we got benefits, we got the UPC scan, we have clinics, location, and operation, stores, location, operation, and we have the ability to send them healthy recipes and other different things. And we're adding to this app capability quite often. So it's a continuation on the improvement here. Thank you.
There's a question in the chat about the recent recall of formula and kind of the challenge for communities to pivot in this time of crisis to meet the needs of our little ones. And it strikes me too that COVID certainly was another moment where we had to pivot and respond to a challenge. I'm wondering if, Barry, I'll turn to you again, if you could talk a little bit more about sort of what were the essential elements of, flexibility to navigate these changing spaces, and, what are you holding on to for any future kind of changes to the space?
Yeah, that's a great question. Thank you for that. Here in South Carolina, we're actually a Gerber state. We do not have Abbott as we do not have a contract with Abbott, but we went through the same process. And we worked with the South Carolina Retail Association, the vendor advisory group. We sent out that, alert right away. We developed some guidance that was provided to the regional program managers and everything on how to return any formula necessary, and also how to get that formula replaced and everything. So it was really a focus on communication, and it was an opportunity to look at our current process and kind of refine those, to really also updating our agency website to put information out there in regards to the alert and getting that information out there. Local media releases across the state. Our senior leadership, doing conversation with legislators and just providing information. So it was a great process. I will say that USDA and the National WIC Association conducted regular meetings with updates that really were instrumental for state agencies like South Carolina to really get that information out to people across the state. So communication, National WIC Association, a huge leader providing information. USDA was very helpful providing information as well. And our biggest challenge was trying to get that information out as soon as possible and be there for our participants and make sure that they had options. Supply chain distribution challenges, we didn't have any of those in the state, but some of those states that were Abbott, I understand that there were some challenges there as well. So how do we, as a program, make sure that we got the healthy, nutritious foods that our participants need? And that's relationship, communicating with those entities across the state. Even when nothing's going on, that relationship is important. So when something does happen, we know who to call. And those are some of the things that we picked up on our after action review that we conducted.
Thank you so much, Barry. There are a number of questions that have been coming through in the Q&A in a similar vein, thinking about all of the data that Aditi presented about online versus offline benefit reloading and the variability among states. So this question mainly for Brian, but would be interested in any other thoughts on this. Is there any opportunity to kind of push forward from federal policy level the opportunity for all states to be moved to online benefit reloading?
I would say that kind of federal requirement would probably take more time than is needed, because I think these conversations are happening at the state level. And again, I think the evidence is quite clear about the effects that we saw during COVID, but also what we're really seeing is where the program is moving to in this next generation of services. We are going to be shifting our business model to be more responsive and reflective to the needs of participants, the emergence of technologies, and the partnerships that we can build with healthcare. And so as we build all of that into our service delivery model, it's clear that the flexibilities, particularly around benefit issuance, are going to be a critical part of how we reach families in the future. And I think these are lessons that have been really well understood during COVID-19. My understanding is that just about every single one of those offline EBT states is having this conversation internally. And so I would say keep that pressure up at the state level, keep having that engagement with the state office about what makes sense for the program in the long term. One of the pieces, and this is a piece we kept reiterating during COVID, is that this is not a flip the switch sort of change. This is a change that does need to take time, be done a little more deliberately. We understood that this is not something that could be fixed within the period of weeks at the beginning of the pandemic. But now that we've assessed, we have the data, we certainly know the effects, and we know where the program is headed. Keep having that conversation with the state office, because frankly, a federal rule on that front could take several years to get in place. And at that point, we'll have had the effects of offline EBT systems for several years, when we could have taken action at the state level far earlier.
I'll just echo what Brian said. The program federally is really taking off. WIC is going to reach new heights and finally move into the 21st century in the coming years. And unless Pennsylvania does modernize its smart card system, we are going to be left behind, left down on the ground. So we really want to be able to take advantage of those long-awaited flexibilities that WIC advocates for many years have known are key to meeting families where they are and boosting participation. I will also mention that I had a great conversation with the leaders of Ohio WIC recently, and they are an offline state, and they are moving. They announced last Tuesday that they are going to move to an online system. This is going to be a really big process, a really big undertaking. There was an anecdote. I'd rather go through transitioning from paper checks to EBT all over again than go from an offline to an online system in terms of all of the technological quirks that there are going to be. But they've made that decision, and it's really encouraging to see this momentum continuing to build.
Thank you both so much for your comments on this, and also for the call to action and advocacy for the 116 participants that we have on the call right now, in addition to the others that'll be watching this asynchronously. I think that Radha has our next question, so I'll turn it over to her.
Sure. Something I've heard through all of your remarks is the importance of collaboration and partnership. And there's specifically a question in the chat here about partnerships with healthcare institutions and what creativity there is in terms of the nature of those partnerships, and even as we're looking at creative staffing solutions for achieving some of the goals of WIC around nutrition counseling and in the maternal and pediatric care settings. So maybe I'll turn it over to Laura and Aditi to talk a little bit about where you see opportunities for those partnerships.
Sure. Thank you, Radha, and thanks, Jody, for that question. I think we are, as a health system at CHOP, definitely excited about opportunities to strengthen connections with WIC, both in terms of improving data sharing, but also in terms of using our encounters with families as a way to really provide not only nutrition counseling, as you suggested, but also potentially connection with benefits. So with our medical financial partnership at CHOP, we actually have a clinic-based resource navigator at one of our sites, one of our primary care clinics, who's able to provide interested families with benefits enrollment support. And we're in the process of rolling out a nutrition screener throughout the CHOP primary care network that would ask families if they want more information about WIC benefits and help getting connected. So I certainly think that's an opportunity for growth in the future. It's really strengthening our health system partnerships with local WIC offices, both in terms of information sharing and helping families get enrolled and recertified, but also, to your point, potentially connecting families to some of that nutrition counseling information, and maybe even doing that in some of the exciting ways that Barry alluded to. If there's a video online that we can direct people to, or if there's some central repository of WIC education resources, just so that we're all providing the same nutritionally important information in a really synergistic, partnered way.
Yeah, and I'll just add, as an advocate and being somebody who works in the space of perinatal and child health, not only statewide, but also locally where I'm located in Allegheny County, we have these conversations all the time about how can we encourage more coordination and partnership so that a family that is low income and that likely is having to, possibly take a bus to a WIC appointment or 2 buses to a WIC appointment or to a doctor appointment. How do we make sure that they're not having to take their kid and get their kid weighed 7 times, right? How do we coordinate data sharing and medical records and opportunities in order to just make the burden on the family less so that they're able to participate in this program and really reap the proven benefits that we know WIC really does offer?
And I would just chime in and say, let's go for the fences here, because there's a lot of innovation happening in the healthcare and Medicaid space as well, and we need to be building these conversations so that we build the systems that can sustain this work in the future. And so you have to be thinking about, how does electronic health information get shared between physicians and WIC clinics? How do we automate those processes so that the physicians don't have to be actively thinking, I need to send this data to WIC, but it just happens seamlessly. And so building those connections, getting those infrastructure technology folks talking to each other is going to be a critical priority for the next couple of years. And we need to be thinking in the long term of not just what are kind of the around the margin solutions here, but what are the fundamental solutions that can set us up for success for decades to come.
Yeah, Brian, I could not agree more. Collaboration is a key to success. In regards to data, we actually work with Medicaid and SNAP. They provide us data, and we can determine, using a GIS map, look at a population on those individuals that live in a particular zip code that qualify for the program but are not currently on the program, and then we could target that from an outreach perspective. We're working with hospital systems across the state, so we're developing memorandums of agreement with them. We're asking WIC staff to go to the hospitals because that's where the moms and babies are. We're partnering with First Steps, Head Start. We attend the Birth Outcome Initiative meetings here within the state, and we're really sharing data. First Steps is working on right now, as we speak, a First 5 portal that is a one-stop shop for all programs that serve, children to age 5 and moms. So it's really about data sharing and everything, and really collaborating with those organizations across the state, because we can't do it by ourselves. We need those organizations. We must work together. We must share data. Now, we do have our process in place. We have to ensure that participants' data is protected. We have a form, I think it's 1862B, and there is a request for information that you can fill out, send it to our state, and it goes through the information request board for approval, and then we'll provide the information. But data really is key in collaborating with those organizations. We also work with an organization called PASOS to reach the Latino and Hispanic community here within the state. That's a fast-growing population in South Carolina, and there's a lot of opportunities there. So what organizations are within your state that you can collaborate with to do the great work that we have to do? And really, we got to identify those and establish those relationships.
Thank you all so much for all of your thoughts. We are going to continue to call on you and think about, especially from the PolicyLab perspective as a research center, what evidence gaps might be in order to continue thinking about WIC modernization. We want to take the moment, can't believe that we're already up against time, to thank all of our participants who've joined us today and to our panel of experts. This has been a fantastic conversation that we hope that we can inform continued thinking about how we can work together to modernize the WIC program, ensuring that benefits reach all children and families who need them. As a reminder, a recording of this event will be posted on PolicyLab's website tomorrow at policylab.chap.edu. And if you are interested in discussing more about topics like this, we invite you and truly hope that you'll join us at our PolicyLab forum that's happening May 9th through 10th at the Kimmel Center in Philadelphia. Please visit our website for more information and to register. And I'll ask if somebody can just post the link in the chat. But thank you all so much and hope that you have a wonderful rest of your day.